So I don't wish to create panic, but it's important that there be a very sharp focus on what the real situation on the ground is. I've got the Delhi government's app open in front of me. It's called the Delhi Corona app. It says that there are 9,444 total beds. It still says live at this time that there are 4,348 empty beds and 266 vacant ventilators. If I click, you actually get a breakup of the hospitals which have free beds. Most of these are government hospitals, and largely the private hospitals have very few beds. But what we've seen, and I want to say this again, that this is not about all private hospitals, but in some of the hospitals that you just saw, they're asking for cash deposits of between 5 and 7 lakh rupees upfront. They're saying they don't accept insurance and that you may need to pay up to 30,000 rupees per day. Joining us to get a sense of what's happening, because the Delhi government feels that by July we'll have about 5.5 lakh cases and we'll need 80,000 beds, and right now there are only 9,444 beds. So you need 8 times that kind of infrastructure. Where will that come from? I'm joined on this broadcast once again representing the Aam Aadmi Party. We have Raghav Chadha. Representing the Bharatiya Janata Party on this broadcast is Amit Malviya. Dr. Giridhar Gyani is the Director General of the Association of Healthcare Providers, which is an NGO that works closely with healthcare professionals. They've been writing to the government, asking the government to ramp up infrastructure, and he'll tell us what happened with all the advocacy they've been doing. Kapil Chopra is the chairperson of the board of Easy Diner. He's here in his capacity as someone who runs charity beds. It's a NGO that's looking at the availability of healthcare for people from economically weak sections of society. So welcome to all our guests. I want to go across to the government spokesperson first, Raghav Chadha. In this investigation, some hospitals, and I don't want to make it about one particular hospital, the idea is to catch the theme and the trend of what's happening and to see if we can play a positive role in trying to fix it. We've got doctors saying that yes, hamare app pe likha hai, but we've got hospital staff saying yes, app pe likha hai, but that's not the reality. We were asked to give and dedicate a certain number of beds. We did that. Hospital staff is not willing to work. We don't have the infrastructure. What's on the app, we've told the government we can't fulfill what's written. You've had an opportunity to look at the report that we put out. What's your first reaction, sir?
Look, first of all, Rahul, let's at the outset make this very clear that this is a pandemic of unprecedented level and nature. I think the best healthcare facilities of this world have collapsed before COVID-19. No New Yorks, Italys and Bombays of the world have been able to put up a fight when it comes to dealing with this pandemic, the outbreak of COVID-19. We in Delhi have been working 24/7. We've been working tirelessly for the last so many months, trying to ensure that a public health machinery is created which is well equipped to deal with the COVID-19 situation. Over the last 75-80 days, we have increased our capacities by leaps and bounds. From 500 oxygen beds, we've gone to 9,500 oxygen beds, and in the next few days you'll see that a lot of hotels are also being annexed to a private and government-run hospitals. But private sector till now has played a very important role, and we cannot paint the entire private healthcare infrastructure with the same brush. At the same time, you have and your channel have done an investigation, and I congratulate you for doing that. It certainly points out that yes, there are certain issues that we need to identify, that we need to solve. And we have done the following in order to ensure that private healthcare setup do not indulge in these malpractices. The first thing that we've done is that we've come out with this mobile application so that anybody who's suffering from this disease can see at a click of a button on a smartphone where do they need to go, where are the beds, where are the ventilators. And I think we're the only government in the country to have done that.
Okay.
The data initially wasn't accurate. Now the data is accurate. Number two, the second thing that we've done is that we are in the process of installing, Rahul, LED displays outside every hospital so that everyone who does not have an access to a smartphone, who visits a particular hospital, can see the price as well as the availability of beds outside the hospital.
Just pause it there. No, Raghav, you've spoken enough. You've spoken for about 2.5 minutes. I'll come back to you.
Just 2 more measures. I wish to give you just a couple of more measures. That's it. Just two more points. Point number 3, we have deployed a medical officer at every private hospital now who will sit at the reception in order to ensure that all these things that you've just showed never happen again. And lastly, those hospitals that still do not listen, that do not come by, those are being penalized. Investigations have commenced and FIRs are being registered and punitive action will be taken. So we are following this 4-step approach. If there is more feedback, critical feedback, we are more than happy to receive it and we will act accordingly, Rahul.
Now, so Amit Malviya, the thrust of what Raghav Chadha is saying is that this is a pandemic which even the New York healthcare infrastructure, which is the best in the world, wasn't able to deal with, and therefore if you think that when New York failed, Delhi will somehow miraculously succeed, it won't. It's a pandemic, it's raging, it's out of control, and therefore there will be problems. They're saying, however, we are being more transparent than any other government in the country. We are looking at critical feedback and trying to make things better. How do you respond to that argument? Amit Malviya.
Well, Rahul, I hope you'll give me exactly the same amount of time that you gave to the Aam Aadmi Party spokesperson. First of all, let's not compare ourselves to New York, France, Italy, or whatever else, because we have our own standards, and some of the states in our own country have done an exceptional job. Uttar Pradesh, adjoining Delhi, has done a good job. Assam has done a phenomenally good job. Karnataka has done well. Kerala has done well. So to say that New York hasn't done well and therefore Delhi is destined to fail is quite an unfortunate approach to take. Secondly, it's the same Aam Aadmi Party that came to power assuring, or rather claiming, that they've built a healthcare infrastructure which is best in the world. How did it all crumble so soon? Third, the lockdown period that was there was for every state government to ramp up its capacity. We heard Arvind Kejriwal speak ad nauseum saying that they have made provision for 30,000 beds. Where are those 30,000 beds? And why aren't people getting beds? Forget 30,000 beds. LNJP, a hospital run by the Delhi government, yesterday a channel did a story, and you know how badly patients are being treated there. In fact, people are going to LNJP to die. That is exactly how bad the situation is. Delhi is not testing enough. They have tested 3.38 just yesterday, whereas the WHO says that the number should be over 10. So obviously they are trying to put down the cases by tinkering with the testing capability. The death per million is highest in Delhi. I can go on and on. They speak about doing enough. Karnataka, for example, is contact tracing 47 people for every COVID suspect. Delhi is doing a mere 2. That is why you have a situation that you have so many cases and Delhi is completely clueless. Official diktat that the Aam Aadmi Party spokesperson spoke about. You know what the fine print is? The fine print is that the private hospital doctors cannot recommend a test unless the government official okays it. It's like state denying testing to patients recommended by a private doctor. He speaks about punitive action. Please tell me, is this the time to take punitive action, or is it the time to take the hospitals and doctors along?
May I now respond?
On the private sector.
So, Mr. Malviya, I think
Rahul, just hear me out. I don't have much to say. On the private sector, the Ayushman Bharat was launched. The Ayushman Bharat set certain compensation for every hospital that was impaneled. Please tell me, what has the Delhi government done? If the private sector has to come on board, they have to be compensated. Health is a state subject. What has the Delhi government done? Have you seen Arvind Kejriwal have any meeting with Doctors Association? No. They have instead gone ahead and filed an FIR against Ganga.
Okay.
They want people to die. They were hoping that this will pass.
May I respond now,
hasn't, and Arvind Kejriwal has his head in the dock at the moment.
Okay, I want to show our viewers on that big screen 2 data sets which are very crucial. First, the test positivity ratio, and then the number of tests being conducted. And then I want to get Raghav to respond, because both these things are happening and they're very, very consequential. If you marry the ground report that our investigation team did with what the data intelligence unit compiled, it throws up a very scary picture. Of every 100 people being tested, the total number of COVID positive cases in the national capital is now higher than it is in any other state. Whether you look at Maharashtra, whether you look at Gujarat, anywhere else. As I said earlier, the number of cases testing positive was just above 12 towards the end of May. That's now jumped up to 25%. the next state, for example, Gujarat is at about 20%, West Bengal, Delhi, Tamil Nadu, much, much lesser. And the other problem, Raghav Chadha, is that because the number of people testing positive went up suddenly, and you can answer why that happened. I want to show the next data set to our viewers, the number of tests being conducted. Now, in this, this is Delhi. So look out here, and can our producers come as close as possible so that you can see this? This is the end of May. So till the beginning of June, the number of tests being carried out is going up. That curve is heading up. Then suddenly, and this corresponds to the period when the number of people testing positive went up, the number of tests being carried out went down. That would suggest at some level, Rahul Chadha, that the government panicked because more people were testing positive. You suddenly came under pressure. That's when you went after private agencies, and that's how suddenly the number of tests being conducted went down. Explain what's going on here, sir.
So first of all, the testing in Delhi is done as per the ICMR guidelines, not by the guidelines issued by the government of Delhi. It's the ICMR guidelines that the government of Delhi has adopted, using which the testing facility in Delhi has been made available. I would like to very humbly bring this to your notice. I thought there would be no politics because we're in a pandemic, and I thought all of us could work together. But when the Bharatiya Janata Party goes on with lies, lies and more lies, I can't resist myself. I need to put out facts, and the facts are as follows. The highest per million testing that has happened in this country has happened in the city of Delhi. 13,000 tests per million. This is a statement. This is a statement put out by. May I just finish? This is a statement put out by your colleague Rahul.
But you are
Rajdeep Sardesai.
You are giving factually incorrect.
Why is he interrupting me? Did I interrupt anyone?
No, one second.
Yes, you did.
Mr. Malviya,
Yes,
Raghav,
you did.
one second. Time out. Hold it, gentlemen. Please don't fight. You know, in any case, most people who are watching are in a state of panic. They are concerned. I know it's a good opportunity to score political brownie points, but I'd rather that we use this conversation for something constructive to come out of it.
Absolutely.
That is key, because you have to save lives. One second, Mr. Malviya.
Yeah.
Let him complete. You know, I'm asking you, one second, Raghav Chadha. You have to answer my specific question. Why are so many people testing positive? Out of every 100 tests being conducted, our data shows 25, which is more than anywhere else in the country, are now testing positive for COVID. That by itself is a scary data set.
I agree, and no one can deny that the infection rate in Delhi is alarmingly high. I agree with you, and therefore I think what we need to discuss now is whether we're in stage 3, that is community transmission, or not. But since allegations were leveled regarding testing, I'm putting out a statement put out by Mr. Rajdeep Sardesai, your esteemed colleague, and he says, and I quote, COVID-19 deaths per million in Mumbai, 88 deaths per million, in Ahmedabad, 182 deaths per million, in Delhi, only 45 deaths per million. When it comes to testing, he says in Maharashtra, 5,100 tests per million, in Gujarat, 4,172 tests per million, and in Delhi, 13,053 tests per million. Now, this figure has been put out by your colleague yesterday. And I'm pretty sure anyone who's read the data will conclude the following. Number one, highest testing has taken place in Delhi. Number two, the mortality rate of Delhi is among the lowest. Number three, Mr. Kejriwal did certainly say that we will create a capacity of 30,000 beds. He said that we will do that in a phased-wise manner. We have accomplished stage 1, phase 1, where we have 11,000 beds. Over and above that, you yourself showed how roughly 4,000 beds are still vacant for patients to come and avail treatment. I am not saying for one that everything is hunky-dory, everything is wonderful, we're in full control of things, so on and so forth. What I'm trying to say is that we are trying to do our best. We have done exceedingly well. This is what the data also shows, and a lot more needs to be done.
Okay,
I would
so
really
the argument that you're making,
let's do away with politics, and let's work together. I would hope that Mr. Malviya's party today can say that we will work together. We will also deploy our MCD hospitals.
Okay, I think you've spoken enough. Now, here's the thrust of the argument, that yes, there are problems, but if you look at the number of people being tested, it's more than, as a per million percentage, it's more than elsewhere. Amit Malviya, I'll take a quick counter from you before I go across to my other guest.
Thank you. First of all, let me just fix the data part of it. The fact is that the death per million is highest in Delhi at 52.59. It is 10 times the national average, which is at 5.91. The state which has the second highest death per million is actually Maharashtra. Even on tests per million, the highest is Goa. They are testing 22,274, followed by J&K and not Delhi. Therefore, it's very convenient to come on television, give out random numbers, quote some random journalist who obviously can't read numbers any better than what the Aam Aadmi Party does. The fact is, Rahul, that there is a problem. Let me tell you, the Aam Aadmi Party has not added a single bed in Delhi in the last 5 years. In fact, it went down by 500 beds. And here you have the Aam Aadmi Party spokesperson waxing eloquent of what they have done. The ICMR guideline he quotes. Has the ICMR said that you should stop testing? Why have they put strictures on private labs? Why have they put a government official to authorize what your doctor orders? Which government official can decide whether the doctor's recommendation should be taken on board or not? This is exactly what Mamata Banerjee tried to do in West Bengal, where she put restrictions on the doctor from signing death certificates. This is exactly what Arvind Kejriwal is doing. This is a book straight out of the communist red book. This is exactly how they get the state to overwhelm the right of private citizens, which is what Arvind Kejriwal's party is doing here in Delhi. They have failed the people of Delhi. People of Delhi are dying. They are dying on streets. They are dying without beds. Please get on social media and you will find well-heeled people not able to get beds and their family members dying. People like you and me are losing their kith and kin because Delhi government has failed them.
Okay, one second. You know, everyone who's watching, and I want to tell both Raghav this, and I want to tell Mr. Malviya this, they're all saying, why are these parties fighting? Can't they realize that there is a crisis and that they need to help us save lives? That's the message. I mean, 10 people have messaged just as they're watching the show,
Rahul,
and that's what they're saying.
Let's not sermonize. The fact is that Aam Aadmi Party is the party in office. They are responsible for Delhi's healthcare.
So
they have failed Delhi. So let's not sound preachy. The Aam Aadmi Party is trying to hide behind this veneer of let's do it together. They are trying to hide their incompetence. Kejriwal is incompetent. He has thrown the people of Delhi to the wolves. That is the reality.
Okay. Dr. Giridhar Gyani, you're part of the Association of Healthcare Providers that's been writing letters to the government asking for healthcare infrastructure to be ramped up. Please tell us what's been the response to all your efforts. What do you make of the ramping up which the government claims has been fantastic and unprecedented, and what are you making of our investigation? Dr. Gyani?
Yes, please. Yeah.
So my question is that you've been writing to the government asking for healthcare infrastructure to be ramped up. The government says they've done an unprecedented job in ramping up healthcare infrastructure and that we are as well prepared as we possibly can be given the circumstances. What do you make of what you're seeing and our investigation, sir?
When we started with the COVID phase, we thought Delhi was the best place in the country, having 57,000 beds, the highest per 1,000 population of the number of beds in the country, of which I can say 11,600 are with the Delhi government, and brought 25,000 are with the private sector. Unfortunately, we have been able to utilize only 5,000 beds from the government side. Maybe there are reasons for that because they are keeping other beds for the non-COVID patient, and also there is a huge shortage of the doctors and nurses. So I think my first point is Delhi government has to look into it, whether they have the enough number of doctors and nurses for the requisite number of beds. That is 11,600 is the number one. Number two, now coming to private sector, we wrote to the Delhi government about 2 weeks back that please do not rush to take 20% bed from the private sector. Instead, we will give them the complete hospital in the all 11 districts. I wrote to them that we can provide you 300 beds in each district, making it 3,300 beds, but having the dedicated COVID hospital, that actually will help us to manage the patient load much better and also minimize the cross-infection from COVID to non-COVID patient. Now also recently Delhi government has taken over another 3,000 beds from the hospital, 22 hospital. We welcome that. In fact, what we want now is the Delhi government should talk to AHPI, which is the largest body of the hospital, the Delhi Medical Authority, DMA, what I'm talking. If to put together, we have to now take on this pandemic. I must tell you here on the viewer that last Thursday, we sat down and brought out the average costing to be charged from the hospital, from the patient, and we fixed 15,000 rupees per day for the general ward. That means for 10 days the cost will not go more than 1.5 lakhs, all inclusive. This we did it so that to minimize, the criticism which was coming, so that our member hospital will be guided for this. Here I would like to impress upon the Delhi government to follow Maharashtra, Gujarat and Odisha model. So that means what they have done now, they have set with the private sector, fixed up the cost for treatment, and for the poor patient, they are incurring the cost directly from the government side, particularly Odisha. So I think something of that sort needs to be done. My advice is don't, have this panic. We are creating a lot of panic in the city, which has to be minimized, which has to be controlled.
Okay, Kapil Chopra, you're running charity beds, virtual real-time audit of the government's claims and the realities. What's been your experience over the past few days? Are beds available, not available? What's your net sense?
So I think, first thing I'd like to tell you, Rahul, in case we want to serve people, then I think the first quality that people need is empathy. If you don't have empathy, then you cannot really be in public healthcare or in public service. So I was quite surprised to see the debate in the first 20 minutes, honestly. I don't want to make any political comment here, but I think everything was being reduced to statistics. And this is not a statistical problem. I think this is a human and emotional problem. So let me start. Charity beds, we've been around 8 years. We've been trying to help economically weaker sections get into hospitals much before any of the governments were in power. So we've kind of worked with everybody. The Delhi government has one big advantage. They have some great hospital administrators. I don't know what's really happened here, but last Saturday, we suddenly realized that there was a very big mismatch because we've done this for 8 years. So we realized there was a mismatch between what the app was saying and what the government was saying and what the public was believing. That's quite normal because the government speaks in a different language. And like your investigation found out that the beds were not ready. So you see what happens is the government takes out an order, but it takes time for the beds to be ready. So what we decided to do was we said, and we could see 2-3 videos circulating last Saturday, which said that people were dying. So we activated all our contacts in hospitals directly from the wards. And we actually started beaming in on my Twitter handle what was the real ward situation. Also, let's look at this in a proper way, really. Yeah? And the proper way to look at it is in Delhi, if you have a coronavirus case today, what does a normal Delhiite do? They go to Gangaram Hospital in case they're in Central Delhi or in West Delhi. Then they go to AIIMS, Safdarjung, Ram Manohar Lohia. So these are the 4 hospitals that everybody was going to. So when everybody was coming onto a channel and saying, I've been to 5 hospitals, the 4 common names were these 4. So what was really happening was crowding was happening, while the reality was that, yes, there were some beds available in the periphery of Delhi. So, for example, in Ashok Vihar, there were beds available. We saw beds were available in Dwarka. We saw beds were available in Rohini. But I don't think that was being communicated enough. Also, I think if you really look at the entire exercise, and I don't understand a reason whether it's this party or that party, I think it's extremely important. Like, for example, in Gurgaon, where I stay, there's a big private initiative trying to work with the government to help sort things out. But I think there's been a misstep after a misstep, which happens if you're not trained into crisis management and nobody's handled. Like Raghav rightly said, it's a pandemic of a global scale. But I think where Delhi is going wrong is 2 things right now. Hospital beds, I still think can be managed, but 2-3 very, very big incorrect facts. Point number 1, I don't think there is any contact tracing of any level in Delhi right now, which I think is a very big danger. I think the number of cases will keep on going up because there's no contact tracing. More than that, I don't think we're doing quarantine the proper way. So I don't think, people are being quarantined. Everybody's just roaming around, even if they're COVID positive, because they're going to 5 hospitals. The person who's driving them is also getting COVID positive. Then there is no contact tracing. Who all did they meet? So it's actually
that's an important point you make. And I want to put that question to Raghav Chadha in the context of people we ourselves know in Uttar Pradesh, who once they tested positive, the district administration came, took them away to quarantine centers and ensured that they stayed there and did very active contact tracing. In fact, some distance away from where I stay, 1 person tested positive and we had people from the police come and sit over there outside that guy's apartment. So that's the level of contact tracing and quarantining efforts which other governments are making. Yogi Adityanath has received a lot of praise and people are wondering why can't you do the same in Delhi?
Well, Rahul, exactly the same thing is being done in Delhi. So, unless you point out to, point towards a particular case where something like this wasn't happened, and the feedback which I'm certainly more than willing to receive, in every case, every positive reported case, not only proper quarantine facilities are being made available, on top of it, contact tracing is being done by the CDMO, that is the Chief District Medical Officer, with the assistance of the local police. Over and above that, we have a tie-up with a tele-medical facility where the family members of the person who's tested positive, as well as the person who's tested positive, if he is receiving treatment at home, gets called by a doctor 3 times a day. His oxygen rate, respiratory rates, etc. are being monitored. They are being advised. Some of them are even being counseled, by medical professionals who are trained, to counsel, to offer you counsel. All this is working in a seamless way, and I would really urge, that you certainly do bring one of those positive cases on your channel,
but
and
the
they share their
reality
experience
also,
with
Amit
us.
Malviya,
Contact tracing, all this is being done. And let me, Rahul,
is that which are the... One second, Raghav. Just try and keep it short. I give you a fair chance to speak, but give everyone an equal opportunity. The reality, Amit Malviya, is that cities like New York, cities like Mumbai, cities like Delhi, that just because of the nature of the virus are likely to suffer the most. And therefore, if Mumbai collapsed or Delhi collapsed, to what extent do you blame it on political incapacity? Because it's just the nature of the city. No matter who was running that city would be the most vulnerable to COVID-19 spreading. Amit Malviya.
That's not true, Rahul. I told you that Karnataka is contact tracing 47 people for every COVID positive case. Delhi is doing just 2. Let's not hide behind the fact that this is a pandemic, we don't know how to handle. That's exactly why you've been elected and put in office. The fact is that the Delhi government has done precious little. Arvind Kejriwal, other than appearing on television every day several times, and preaching about what their government plans to do, hasn't done much on the ground. And that is the reality. You see, Delhi was doing fine till the time the lockdown was enforced. But the moment liquor shops were open, people were allowed to come out, the pandemic just blew. And Kejriwal is responsible for it because he wanted money for his advertisement extravaganza. He just let the city, go to dogs. And this is exactly why we are all suffering. Let's not try and protect Arvind Kejriwal for his incompetence. He did this in the migrants issue. He's done this with contract tracing. He's failed to build capacity. He could not even manage a hospital like LNJP. And I heard the gentleman who was speaking from the charitable organization saying you need empathy. I agree. And the Delhi chief minister completely lacks it. That is the problem. That is why Delhi is suffering. He thought perhaps that this gene will mutate on its own, or migrants will go out, Delhi will be fine, he will come out smelling like roses, but unfortunately for him, it's blown in our face.
Dr.
And today, every second person you speak to is suffering. There is no oximeter, nobody is calling anybody. There are several videos out there in the social media. If everything that Aam Aadmi Party is saying is right, then why are we seeing these deaths?
Dr.
Why are we
Gyani,
seeing people die on streets?
Did the government use its time well when there was a lockdown? We heard a lot of claims, but on the ground, did they actually substantially bolster capacity? Was a genuine effort made? Dr. Gyani?
Yeah, you see, as I told you, there are 22,000 private beds, out of which 12,000 can be used for the COVID. There has to be a proper dialogue between, the government and the private sector, number one. Number two, although they created almost 16,000 quarantine beds, I am told, but the issue here is I will not use the word we fail to train the requisite number of healthcare workers to manage this. You can create any number of makeshift hospitals, but where are the people? Where are the healthcare workers? Where are nurses? Where are the, ward boys? I think that is the one where perhaps we have failed together, and even now is the time that short-term training can be done, like ASHA workers, to deploy in these quarantine centers. We can still...
That's the other thing that came out of the investigation, which Dr. Gyani just pointed out too, that is not just having healthcare beds, it's also about whether you have the hospital and whether you have the doctors and the staff who can ensure that those beds are serviced, because a lot of private doctors are concerned that with the seemingly adversarial approach that the government has taken, the FIR is being filed, they claim that morale has gone down and that doctors are simply refusing to work. In one hospital, there was a report that they hadn't been paid salaries and therefore they were not willing to come. And therefore, we have to ensure that the maximum staff that's available is motivated to come out and work, because if they sit at home, then you can have the beds and no doctors. One second, Kapil Chopra.
Very briefly.
Yes. So I really, I totally agree with you, Rahul. So I think a couple of things on healthcare workers. So, this rule of 20% hospital to be reserved. So it's a quick fix because you want to get to the bed number. I think that's an incorrect rule, because you see, hospitals are not equipped. Very rightly, they said we can't. You did not plan the hospital that way. I think, the most important thing that needs to be actually done is have separate COVID hospitals and separate hospitals, to handle the rest of the emergencies. I think that's one critical point that needs to happen. Two, we risk infecting the entire healthcare worker population in Delhi, which is very critical, because when that happens, then this pandemic will reach a different scale. So I think those two things are extremely important. I would also like to respond on the point of contact tracing. I think it's a very good formula, what Mr. Chadda just shared, but it's not happening. It's 95% not happening. So I think that's very clear. I think the second part is, I think at one level, it would have been great if the health ministry at the center and the state government would have come together, would have requested 7 or 8 great private organizations to come together and help them. Why couldn't we have a great model admission procedure at LNJP? Why did it have to be like this? If LNJP is not doing well, I don't think it's a problem of the Delhi government also. I think it's all our problem too. I think, private citizens like me are getting in because we are realizing that the government is failing at one level, at both the center and the state, in my opinion. And, it doesn't matter to me on who's failing. It's extremely important that as fellow citizens, everybody comes together and tries to do something and not shirk responsibility.
I'm out of time, but I hear what you're saying. And that's an important point.
Other hospitals.
Because
it's not about the bed, it's about the health.
Okay, Raghav, I'm completely out of time, so I'm going to give you only 20 seconds to complete the argument.
Yes. No, first of all, you see, Delhi, we are doing what we can, Rahul, but it is also, and I would urge the BJP to give up this dirty politics and work together with us. There are more than 12,000 central government-run hospital beds and 3,500 beds in the MCD. Neither the MCD beds nor the central government beds are being used. All they do is this dirty politics. I am ashamed that I have to breathe the same air as these people. I am ashamed I have to breathe the same air as these people. Look at what this man is doing. Look at what this man is doing on your show. I mean, for how long can you play this dirty politics?
And you are giving sermons here.
Politics.
Shameful.
Stop this politics.
Disgusting.
Work with the people.
Aam Aadmi Party guys should be ashamed of themselves for doing what they've done to Delhi.
I am ashamed. I have to breathe the same air as this
should
gentleman.
be ashamed of himself.
It is that you abusing Arvind Kejriwal is not going to solve your problem. Work together with the people.
It is threatening the city, its healthcare infrastructure, and you guys are responsible for it.
You see, I can only have a debate with a civil person, Rahul, not with these people who come here on your channel to abuse elected representatives. I have come with a very positive mind. I really sincerely do hope that all governments will work together.
Okay.
It has failed the city of Delhi. People are dying. Do you understand that?
And
you can't run
abusers who show on your TV.
You can't even run a hospital like LNJP. And you are lecturing about positive mindset.
Will abusing Arvind Kejriwal solve your problem?
Okay, I'm out of time. I need to call a hard stop on this. The reality is that we can allow this fight to go on for the next several minutes. There is a massive challenge. I just wish that all our energies at this moment were concentrated on the issue of trying to deal with the challenge. It's a real serious healthcare challenge. People don't care about politics, who performed, who didn't. There will be a very serious post-mortem, but at this moment, the only level of interest is, can people be tested? If they require hospitalization, can they be taken to hospitals on time? Can they be treated on time? Do they have doctors? Do they have beds? Do they have staff to be able to take care of our patients? And I think our investigation is very significant. It gives you a sense of some of the challenges. We'll track what happens from here. For the time being, Dr. Giridhar Gyani, Kapil Chopra, Amit Malviya and Raghav Chadda for joining me on this broadcast. Thank you. I'm slipping into a break. When we come back, there's been a high-level briefing